Good morning and God bless. Welcome to the Saturday Town Hall edition of The Front Page. I'm Dominique DiPrima. So glad you could be here. So much going on. You know, we want to give acknowledgement and praise to the March on Washington, taking place in honor of the anniversary of Dr. Martin Luther King's March on Washington, the I Have a Dream speech. We want to give acknowledgement to the Chicano moratorium, the 50th anniversary of that seminal protest moment here in Los Angeles is today. Want to give honor to Michael Jackson on his birthday with a little Heal the World, and certainly an appropriate song in so many ways for what's going on in our world. And of course, we want to dedicate today's show to T'Challa himself, Chadwick Boseman. Such a devastating loss for our community. Rest in peace, King. Really, really so sad. Today we are focusing on COVID-19, the science, the latest, so that we can understand where we are with testing, with treatment, with vaccines, anything that you may have a question or be confused about. There is so much information coming at us all the time that it is tough to stay on top of it, and yet it's important that we do. As our kids go back to school, as we go back to work or stay at work, some of us have never left work at all, there are opportunities and there are definitely precautionary things that we need to know. So that's what we're here for today. We have some incredible guests for you today. I'm really excited to talk to the guests that we do have. I want to give a disclaimer. The physicians on this show are not here to provide individual medical advice. If you have concerns about yourself or someone else, please consult with your primary care provider. There are protocols in place for that. You can do telehealth, and then you can get advice for how to move forward. What we are here to do today is to give you a general understanding of where we are with the science of COVID-19. I'm very thrilled to partner in this effort of getting the latest news and information during this crisis, during this pandemic out to the people with Council President Emeritus Herb Wesson Jr., the great city of Los Angeles, Community Build, which is a community-based organization, the Independent Professionals Association, you can find them at indiework.org, and 2nd District Supervisor Mark Ridley Thomas. What an amazing group of partners. Welcoming now to the show, Dr. Nkiruka Emeagwali. She is an M.D., M.S., Ph.D., a physician and a scientist with a focus on viruses. Also an intensive care doctor who's cared for hundreds of New Yorkers with severe COVID-19 during the height of the pandemic. She volunteered to be on the front lines with the New York COVID-19 disaster relief team, and she's also the founder of Live Your Best Life Incorporated, which is teaching us how to do just that. Welcome to the show, Dr. Emeagwali. Thank you so much for being with us.
Thank you. I'm so excited to be here with you guys today.
I think one of the reasons why we have so much skepticism and so much weird sort of pseudoscience going around with COVID-19 is because the information is constantly changing. And that makes the general public, who are not scientists, feel like someone's lying or something's wrong with this picture. Can you sort of explain, that concept just a little bit?
Yeah, absolutely. We actually, Dr. Taylor and I wanted to sort of present and organize presentation of how this is looking. And so we were going to first talk about the virus and the virology of what it looks like, and then kind of discuss different prevention strategies that we have for transmission, discuss current testing, and then look at what happens in the ICU during my time in New York, and then look at the sort of post-COVID syndrome patients that we're seeing sort of weeks to months after infection, like what they critically are presenting with in our clinic. But I think one of the things, just to kind of generally touch on that point, is that, in the middle of a pandemic, we as physicians and scientists, we look for evidence-based research, which goes through a rigorous process that's peer-reviewed. And we didn't have the luxury of time to do that. And so what we initially had was just empiric data that was coming from China and Italy to the U.S. based off of their experiences about what was going on, how the disease looked, what treatments were being trialed, what worked, what didn't work. So we have to really just use like the social network to sort of get the information out to different countries. And so we didn't have a lot of time to go through a peer review process in the beginning. But months later, we actually do have a lot of data, and we're taking the time to really analyze that data, to really do due diligence to figure out what really works and what doesn't work. And so even in the midst of a pandemic, we're still having to, on one hand, take care of patients with limited capacity and staffing for the volume that we saw. And on the other hand, we also have to think about ways to not only generate the data, gather it, but also analyze it and get it back out to the public. And so I think that sort of complicates it. And then you also have different levels of analysis. So you have the federal government, you have the state level, and you also have individual institutions, and they all have different resources. And so while we look at the state federal guidelines, lots of the academic institutions really kind of mobilize their scientists to begin to look at COVID-specific protocols that could work in their local areas, which was highly dependent on what they had access to. So not everybody had access to as many patients, et cetera, et cetera. So we're looking forward to kind of going through this with you guys from beginning to end.
Right, and you have to forgive me. I'm going to insist that we translate this into regular people language as we go along. I know you guys are doctors and scientists, and you spend a lot of time talking on that high level. But sometimes it's important for us to kind of get it in terms that we can really get our minds around. Bringing another voice into the conversation. He was born and raised in New Jersey, went to Morehouse College in Atlanta, Georgia, Johns Hopkins School of Medicine in Baltimore, Maryland, got a Ph.D. in molecular biology and genetics with an emphasis on immunology, and he's had faculty positions at Vanderbilt, University Northwestern, University Feinberg School of Medicine. He's currently in the faculty at State University of New York, Upstate Medical University in Syracuse. Dr. Harry E. Taylor, welcome to the front page.
Hello, hello, hello. I'm so pleased to be able to join you guys today.
Yeah, it's great to have you on. Dr. Emeagwali indicated that you guys really wanted to start out giving us an idea of what COVID-19 really is as a virus, and why it's such a menace. So maybe you want to start there.
Sure. So a few things that we want to get straight. First is that COVID-19 really describes the disease that people have after they get infected. The virus is part of a large family of viruses called coronaviruses, and it's not named after the beer. And the corona refers to the structure of the virus. The virus, when you look under it under an electron microscope, looks like it has a crown on it. Okay, so that's where it gets its name. And so these viruses typically cause respiratory tract infections, colds generally, but this new virus that causes COVID-19 is pretty robust. It's a very infectious virus, and so we've had to learn quite a bit of things on the fly with this virus because, as I mentioned, generally these viruses infect the upper respiratory tract, but this virus is able to infect not only the upper but also the lower respiratory tract. And the interesting thing about it is that it's actually released into the air through lipid droplets, through talking, through yelling, through singing, which makes this really dangerous and easy to transmit. Because during the early course of the infection or the pandemic, we had really no clear idea as to whether or not this virus was transmitted through the air, through these lipid droplets. But once that became known, it became clear how easily transmittable this virus is. And so, as I mentioned earlier, the virus typically, viruses in this class, will infect the lungs, they can cause pneumonia, but this virus can actually infect the kidneys, it can infect testicles, and it causes widespread inflammation and a tragic effect on the body overall. And so this really outlines why it's really important for us to try to limit or prevent infection by including practices like social distancing and also mask usage. And I think Dr. Emeagwali will want to provide a bit more insight as to why that's really critical for this virus versus others that we've come across in the past.
Now, that's an important conversation because this is one of the things that I hear people really arguing about. Well, first they said don't wear masks, then they said only doctors should wear masks, then they said do wear masks, and people find that fishy. I've also heard people, lots of people, smart people, saying that they feel like by wearing the mask they're going to re-inhale their own sort of toxic fumes and make themselves sick.
Sure. So there has been a sea of misinformation surrounding COVID-19, the virus. And the unfortunate thing is that there are not enough positive, accurate voices pushing right, correct information. So this is why we're really interested in trying to get the word out about what the truth is about this matter. But you think about it, surgeons and physicians, healthcare professionals wear masks when they treat patients on the regular. And so it's really a fallacy that wearing a mask is going to cause you some sort of damage. But there are a few rare conditions where wearing a mask will present some harm to an individual. But for the most part, most individuals are fine wearing a mask. It doesn't present any danger at all. But again, the critical thing to think about here is that this virus is released through these lipid droplets that can be derived from yelling, talking, breathing even. And masks have been demonstrated to clearly reduce the amount of release of these lipid droplets that actually contain the virus, which can infect others as well.
And Dr. Emeagwali, this is not some theory for you. You guys have been in the intensive care units treating patients, and neither one of you guys have gotten sick, and I'm guessing you're wearing masks.
Yeah, so absolutely. I really want to hone in, Dr. Taylor. Thank you so much for really giving us a nice overview of the coronavirus. The thing to think about is, like Dr. Taylor said, when you speak, sort of, you have like this mist from your breath that comes out. And you know that coronaviruses in general can be locked up in those mist particles, okay, called droplets. And when you wear a mask, you sort of prevent the mist from going into the air where other people around you who may or may not be wearing a mask can then inhale. So kind of to take a step back, we think about how is this virus transmitted. So we know that there are little parts of human cells, they're called proteins, that actually allow the virus to enter. So the virus does not survive and cannot replicate without getting into the human cell, because it uses the human cell's machinery to then replicate and then leave the cell and then release more virus particles, okay? And so gaining entry into the human cell is very important. So then the next question is, well, do all human cells have the right contact or the right protein to let coronavirus in? And the answer is no. We know that there are certain human cells that do. And so we're thinking about this transmission, they're mucous membranes. So those are like sort of membranes or coverings on your eyes, in your nose, and in your mouth that have the access point in the human cells that when the virus makes contact with the cells in the mouth, in the nose, or on the eyeball, inside the eye, then they can actually, the virus can attach to the human cell, get into the human cell, and then replicate or have babies. And once it has babies, it releases those babies out to then infect more cells that have those entry points, okay? And so when we say wear masks, we not only does it help prevent you from spewing the virus if you have the infection, but it also helps cover your nose and your mouth and your eyes via goggles from the particles that could be in the air, the virus particles in the air around you that could come into contact with those surfaces. And so in the hospital setting, we actually worked in my particular hospital 16-hour shift, and we had to wear the mask, and we wore goggles, we wore face shields, and we covered not only our mouth, but our nose. And I know in the public, I see a lot of individuals walking around with masks that sort of hang under their nose and just over their mouth. And it's very important to understand that if you have to cover both surfaces, and, we're even recommending goggles when you're in tight spaces like airplanes, for example, because those surfaces we know are entry points for coronavirus, okay? That's why we really stress this. And so when you have these masks, obviously they're not all the same. We have different types of masks. We have respirators. And we, in general, we think that we know that wearing masks will help to prevent transmission. And we have seen in our staff that when there's compliance in the hospital with mask wearing, and we tend to wear N95, which are respirator masks, because they prevent both us from getting the virus better and, us from releasing, if we have it, into the atmosphere. We do utilize those. We use those very effectively during the surge in New York. And it was incumbent upon us to really get this idea of what personal protective equipment works so that we could stay healthy to take care of the patients that were coming in at record numbers to our emergency rooms to be treated for this disease. And so I really want to stress the prevention. We do not have a cure for coronavirus, but we do know how to help prevent. And one of the things is wearing masks. Second thing, like Dr. Taylor said, is socially distancing. And so really having that space apart from your neighbor, 6 feet has been recommended, so that even if you're in a space with coronavirus, the distance will hopefully decrease the ability for those particles in the air. And we know now that the virus can survive in the air for up to 3 hours in studies. So those particles will have a less of a chance of getting into your space and you inhaling them if you're farther apart.
Got it, yeah.
Yeah.
I think one of the things that I'm a little mindful of here, because, I host a radio show 5 days a week. Not at all a doctor, don't claim to be one, but I hear the concerns and the responses that the community, especially our community, is having. And I feel like people are telling us the same thing over and over again. Wear a mask, wear a mask, wear a mask, social distance, social distance, social distance. But I love that you're going into the why and how, how this enters our body and why it's so contagious. And, I think part of some of the confusion that is around this whole idea of testing, right? So we added on top of that confusion, there are several different kinds of tests. We're hearing about a rapid test, and the CDC, again, talking about changing the guidelines for testing this week, which is confusing. Dr. Harry E. Taylor, what would you tell us as far as, navigating and understanding the role of testing and whether we should go or not go, and, and how this helps us get back to whatever normal is going to be, at least get back to school and get back to work?
Testing is an absolutely required piece to solve this problem. And if we would have executed effective testing early on in the pandemic, we wouldn't be in our current state of affairs. And so the classical piece of strategy, public health strategy to limit a pandemic or an outbreak, is to identify individuals, test, treat, isolate. And we have not been able to do that effectively. And so you have individuals, some which are symptomatic and others that are asymptomatic, that are roaming around and are able to still transmit this virus to others unknowingly. And so our testing capacity has been really stalled for a number of reasons, some political, some not. I won't get into the details of all that. I think many people can surmise as to how we've gotten to this point. But the best tests right now are diagnostic tests that really detect the presence of the virus in individuals during active infection. So it's absolutely critical to identify individuals that have active infections so that you can then isolate those individuals or encourage them to quarantine. And this has been part of the strategy for most of the universities that have started to open. And most of the universities that have done best, they have tested students prior to their coming back to campus. Many of them test students pretty regularly after coming to campus, and they have encouraged those students to exercise social distancing and also encourage them pardon me, to get tested frequently while they're on campus. And one campus in my backyard here at Syracuse has done a phenomenal job in testing their students on campus, and they have really limited the number of cases on campus. But there may have been a couple of cases on campus, and most of these kids came to school positive unknowingly because most young individuals don't really have severe symptoms. But then you look at institutions like University of Alabama, where 500 to 800 students on campus are infected. Presents a major problem, and it presents a problem for containment and limiting infection to others. And so the main thing here is that in order to stop this infection, you really have to identify individuals who have active infections, and you can only do that by using a sensitive test that can identify those individuals effectively, accurately. So there have been a number of other tests that have come on board. There's the rapid antigen test, and I think it's really too early to really give a statement as to how effective that will be. And there are another class of tests called antibody tests, and those tests don't determine if you have an active infection. They really provide evidence that you've been exposed to the virus at some point in time.
Got to take a break right here. We will continue our conversation with Dr. Emeagwali and Dr. Taylor and add one more voice to the conversation when we continue. Love to get your phone calls, 520-KJLH, 520-5554. Radio Free, 102.3 KJLH.